Denise, thanks very much. Thanks very much. Get ready to lose more sleep. The time change is this weekend, spring forward, and the alarm clock will sound an hour sooner. Americans were already struggling to get enough shut-eye, but it's Sleep Week on Good Morning Tri-State, and this morning we're going to try to help you get a little more, get you and Mr. Sandman reacquainted. We put a sleep quiz on our website and asked viewers to answer a few quick questions at home. And this morning, Dr. Sanjiv Patel with Sleep Care Diagnostics joins us to talk about what those answers mean. Good morning, Dr. Patel. Nice to see you this morning. Now, we asked people, do you have problems snoring? Do you have problems, do you feel tired during the day? How do you know if you have a sleep problem that's something that needs to be treated?
It's a good question. The first thing is how do you feel when you wake up? We've done polls and found out that 50% of Americans out there wake up tired, or they're tired throughout the daytime. So if you're waking up tired, then these are the questions we want to start to evaluate. Is it more from bad sleep habits, caffeine, alcohol, or do you snore and you have something else like restless leg syndrome or sleep apnea? And that's one of our biggest concerns, is sleep apnea.
Now, sleep apnea, please explain what that is.
Sleep apnea is where the airway just above the vocal cords actually starts to collapse or close down when you're sleeping at night. Typically, patients will notice loud snoring. The whole family's complaining about their snoring. Someone will hear them hold their breath or stop breathing. Or they may actually wake up gasping or choking.
Okay.
We think about 18 million people in the country may have this, maybe even more. Only 5% have ever been actually diagnosed.
Yeah. Some of the questions we had on here: are you fatigued? Are you overweight? Do you have high blood pressure? Has anyone told you hold your breath, move restlessly, or make a snoring noise when sleeping? If you have just one of these, should you be concerned?
Sure. If one of those are there, it should be at least a trigger to ask about the other questions and think about the other things. At least bring it up, ask your spouse, anyone else, any of your bed partners, or even talk to your physician about it.
Right. Also, a lot of talk lately about the drug Ambien and other sleep drugs, but mostly about Ambien. Is Ambien safe, and are sleeping pills safe? Are they not addictive? Are they addictive? What's the truth here?
Good question. Ambien is a good drug, when used in the right situation. And that's a big thing with a lot of these medications. They all can be very safe and effective, but used in the proper setting. We always tell people to talk to their physicians about it, let them know what other medications are on, and use it as directed. One of the big things is avoiding alcohol.
People are drinking and taking it, and then
exactly. Or worrying about other sleep problems are there, and you're just masking it with sleep medications. And that's why part of the quiz was developed to help you realize, could there be something else?
Yeah. Okay, you can go to WCPO.com to take a look at that quiz, and Dr. Sanjiv Patel with Sleep Care Diagnostics. They have 3 locations in the Tri-State. Appreciate you coming in this morning.
Thank you very much for having me.
It's nice to see you. Now here's ABC with a look at world news.
Good morning. Here are the headlines from ABC News. The jury in the death penalty case